Welcome to our 5 on 5. Please welcome back Dr. Jim Shames, Health Officer for Jackson County. Jim, good to see you.
Good to see you again, too.
So we're going to talk about mostly opioids here, but since we're here in Jackson County Health, what should people be aware of, or what should people be doing or limiting in regards to all the smoke that we're seeing here in Jackson County?
Yeah. So the first thing to know is that you're going to have to take some responsibility for evaluating the smoke as you see it. If you look out and you can't see Roxanne from Medford, you know that we're having a big smoke problem here. And people have responsibility for others, like people who are responsible for young children, perhaps coaches who are trying to set up football practice, those who are elderly, heart disease, lung disease. The safest thing to do is stay indoors.
Okay.
Stay indoors in an air-conditioned space where the air can be filtered. And if you go outside, limit your activities. And it's going to change. So Prospect was really bad yesterday. Crater Lake was really bad yesterday. It wasn't quite as bad here. You know, Ashland was bad, and then today, you know, you have much better visibility. So I guess what we're asking people to do is educate themselves, use common sense, and protect those that are most vulnerable.
Okay, and back to our main topic today, opioids. How is Southern Oregon, how is Jackson County so on top of this early? It seems like you guys kind of running the lead, for lack of a better phrase, across the state on opioids.
Right. Well, I think in part because we had a bigger problem than other parts of the state. It came to my attention from public health perspective early. I suppose you could say it's fortunate that, you know, the right people were talking to the right people, so that, you know, Dr. Olson, our medical examiner, informed me of the magnitude of the problem.
Sure.
I saw it as a public health problem. We had lots of cooperation and continue to have cooperation from the medical community, the insurance community, public health, and others. And yeah, at this point, I think we are geared up, and we are making changes. There are fewer people overdosing and dying. We have fewer inappropriate prescriptions being written. We have law enforcement that's geared up, making saves with naloxone. And many of us who kind of started this in Jackson County are now consultants on a statewide basis, so that these same successes can occur all over the state.
Are we ahead of other states? You know, as far as Oregon versus other states,
yeah, I think we are.
Across the region or the country?
Yeah, I think we are.
Okay.
I think, you know, those things are sometimes a little hard to prove statistically, but
Understood.
But yes, Oregon is finally getting some traction and you know, making progress here.
Excellent. All right, we're going to take a quick break. Not much more in a moment. Stay with us. Welcome back to our 5 on 5. Again, we're here with Dr. Jim Shames from Jackson County. So the president recently declared opioids a national emergency.
Yes.
What does that mean from your perspective, and what happens next? Well,
once something's declared a national emergency, it opens up resources that are hard to get otherwise. And we certainly need lots of resources. The CDC has been granting the Oregon Health Authority funds, as well as SAMHSA, and that's great. But we can use more help. More projects, more people and boots on the ground to get this done. So I applaud that effort.
Okay, and I imagine that's a multi-pronged approach, you know,
Yes.
because you're trying to get doctors to prescribe less. You're also reaching out to consumers themselves. I mean, how complicated is that?
You know, it's not terribly complicated when you kind of keep a goal that's very specific in mind, which is that we have way too many opioids in our community, and then you look at all the different ways you have to control that. So yes, healthcare providers, those that prescribe, need to learn the latest techniques on the treatment of chronic pain, control the amount of opioids they use for acute pain, get people who are physically dependent on opioids, addicted to opioids, to be in a safer place, be it reducing the amount of medication or getting them on a safer medication like buprenorphine or methadone, for example. People who have overdosed, to make sure that there's a rescue medication, naloxone, available everywhere, and then folks who do get rescued, to get them into treatment so that they don't put themselves at risk again.
And what's the best method for people to kind of learn out, for lack of a better phrase, on the dangers of opioids and what they should do or what they should avoid?
Well, one resource is Oregon Pain Guidance, which is a website that we developed here in Jackson County. It's now a statewide resource that's being used throughout the state as a way to inform both professionals as well as the public.
Okay, very good. Good to see you again. Thanks
Good
so
to
much
see
for
you
talking
again.
to us today. Appreciate it.
You bet.
Stay with us. We'll be right back.